Hi, thanks for joining me, and hopefully you're joining me from the previous video in this series where we determine whether you have femoral anteversion or retroversion. If you haven't watched that video, please watch that video first and do the test, and then come on back for this video if it's the appropriate one. Okay, so this video is about what to do in the case of femoral anteversion. The interesting thing about femoral anteversion is that this is the condition that more women than men typically encounter. More women than men's thigh bones are rotated inward. I think this has something to do with why women have a higher incidence of ACL tears in sports. It's because their thigh bone is rotated in. The consequence of this is that the hip joint and the knee joint do not like internal rotation. More internal rotation of the thigh bone at the hip joint and the knee joint increases compression in those joints and breakdown of tissues. And I believe what's often happening in sports is that the femoral anteversion is uncontrolled. And so this is breaking down tissues in both the knee and the hip. By the way, this also plays out at the SI joint, sciatic issues, the back, and the foot as well. Okay, what to do if you have femoral anteversion? We need to decelerate the amount of internal rotation that thigh bone is going through. We need to slow that down or limit it in some way. Well, what is the one muscle that would do that? It is the butt muscles, the gluteus maximus. I'm going to take a pause here and ask you to please subscribe, like, and most importantly, share this channel with others who might be in pain, because this information helps a lot of people. Thanks for doing that. Okay, so we just learned that the butt muscle is the main controller of the thigh bone. The butt muscle, the gluteus maximus, externally rotates the leg bone. Or in the case of femoral anteversion, it's going to decelerate the internal rotation. If you have femoral anteversion, you need to have stronger butt muscles than most people to control that naturally occurring internal rotation. What is one exercise to do that? Well, the one that I like is getting down on your elbows and knees and raising one leg up until you can feel that your butt is activated, and then pumping your leg in that position. You don't want your knee to move down too far because that will turn off your butt. Now, if you have femoral anteversion, you might notice that, gosh, I don't even feel my butt turning on up here at all. So in that case, what you want to do is you want to rotate your knee out just a little bit. I call this peeing on the fire hydrant. Basically, what that's doing is you are externally rotating that leg a little bit, which biases the butt muscle to turn on and activate. Then you're going to do your butt pumps like that. However, as you get stronger and your gluteal muscles turn on better, you should be able to rotate that knee back to center again, because this is where you're playing sports or walking with your knee facing forward rather than facing to the outside. I would do about 20 to 30 reps per leg and 2 sets to fatigue. And then eventually, especially because you have femoral anteversion, I would eventually drape an ankle weight across your thigh up to about 10 pounds and be able to do 20 to 30 reps for 2 sets with 10 pounds in the back of your leg, especially if you're playing sports, because you need really a lot of control of this thigh bone to prevent tears, meniscal breakdown, labral tears, ACL problems, all sorts of problems. The other thing that is turning off the butt muscle is likely how you're walking. Most people walk by sending the foot out in front of them, and they have a strong heel strike. What happens then is that the knee then locks, and when that knee locks, it turns off the butt muscles. How are we going to fix this? First of all, we have to test whether this is happening in you. What we're going to do is we're going to have you put your fingertips on the meat of your butt, not down here, not at the top, but right in the center of your butt muscles. Okay, now you've got your fingertips on that center area, and you're going to pinch your butt cheeks together, and you'll feel that your butt muscles have just become firm, and that is your maximal gluteal contraction. Now relax those, keep your fingertips there, and I want you to walk around naturally 5 or 10 steps and see if you're getting any of that contraction happening when you're walking. Likely you are not, which is why you're watching this video. Clearly, your walk is not activating your gluteal muscles. How are we going to get those to turn on? The easiest way is to simply go up on your tippy toes and walk around on your tippy toes. Go ahead and do that and keep your fingertips on your butt muscles while doing that. And you'll feel that your butt muscles are turning on a little bit now. while you're walking. Well, that's what they should be doing even when your heels are down. So what we're going to do is I'm going to ask you to do this one more time. Walk around on your tippy toes and then keep your fingertips here while you slowly lower down your heels again to the ground, and you'll notice that your butt muscles are now turning on more than they did initially. And this is because you are fixing your gait pattern. I would recommend doing this exercise every time you get up from a chair, walk from one room to the other, anytime like that, and you'll start turning on your butt muscles naturally. In probably 3 to 5 days, you won't have to pay attention to this anymore because you will have fixed your gait pattern and it will naturally be turning on your butt. What is it about this that is causing your butt muscles to turn on? Well, there's two things that are happening on tiptoe walking. One is that it's impossible for your foot to be out in front of your body during tiptoe walking. Your butt muscle has less likelihood of turning off. The second thing is that you'll notice that you can't lock your knees when you're tiptoe walking. So these two things, if you can just simply have your body move forward with your foot while you walk and keep your knees soft, then your butt will turn on all by itself and you don't even have to do tiptoe walking. So I want to say one more thing. The problem isn't that your thigh bone is internally rotated, that you have femoral anteversion. Lots of people have femoral anteversion. Lots of people have femoral retroversion. The problem is you don't understand how to use your body given this knowledge. So this video will help get you on your way. Now, the next video in the series is about chronic tension, and I recommend you watch that right up here. I've also created a masterclass for back and sciatic pain. I strongly recommend that you watch it. It's free right over here. Thanks for watching.